Hi everyone, my name is Dianara and my educational project is on oral care for the prevention of non-ventilator associated pneumonia. Hospital-acquired pneumonia, or HAP, is a common and potentially life-threatening condition that affects patients who are hospitalized for extended periods of time. The primary cause of HAP is the accumulation of oral secretions, which lead to aspiration and colonization of the lower respiratory tract. Routine oral care can prevent the accumulation of oral secretions and also minimize the risk of HAP. For my PCOT question, for telemetry nurses, how does an educational project on oral care compared to no education affect the willingness of staff to comply with oral care guidelines post-educational session? The project aimed to conduct an educational project, as I said, at my hospital unit to educate nursing staff on the importance of oral care and the potential need for standardized oral care protocols. The objective is to improve adherence to oral care practices, which will in turn reduce the incidence of non-ventilator associated pneumonia. So, hospital-acquired pneumonia are a common and serious problem in the healthcare settings, accounting for 25% of all healthcare associated infections, according to the literature. Additionally, non-ventilator hospital-acquired pneumonia can increase the length of hospital stay. It can also increase the risk of mortality and the cost of care, as it is estimated that the cost of NVAP range between $28,000 to $40,000 per case. Studies have also shown that patients who receive routine oral care have a lower incidence of NVAP by 40 to 60% compared to those who receive infrequent or no oral care at all. Also, according to the Joint Commission, while NVAP is a significant patient safety and quality care concern, it is not currently recognized as one of the National Database of Nursing Quality Indicators for which hospitals are held accountable. It is also not one of the conditions that the Centers for Medicare and Medicaid Services requires hospitals to report to the CDC. And the National Healthcare Safety Network, and it is also not integrated into the CMS, current pay for reporting, or performance programs. So that is not good, which could also be the reason why hospitals are getting away with not having specific guidelines as to how frequently we should be doing oral care in the acute care setting. So, for my intervention, the issue of oral care was discovered during one of the hospital's annual reviews at my unit, which showed a reduction in oral care charting. So, that's not good at all, right? I did an educational presentation. It was brief. It took about 10 to 15 minutes to deliver the information. I did that during huddle. And then I also gave the participants a post-learning survey, which evaluated their willingness to adhere to oral care guidelines. It also helped determine the educational campaign's effectiveness and identify areas where additional training was needed. And yeah, lastly, I did the post-learning survey evaluation. So for the data, I got an average score of 34.3 points. The participants were really nice, but this proved that there was an increased likeliness from staff to comply and adhere to oral care guidelines and reinforce the understanding of the importance of oral care for the prevention of non-ventilator associated pneumonia. I have my post-learning survey here on the right. it pretty much measured the effectiveness by assessing the impact of the project on the intended goal of prevention of non-ventilator associated pneumonia, and adoption by assessing the extent to which staff was willing to comply and adopt the new recommendations, and change by evaluating the integration of implementation. So those were the three main areas that were evaluated in this post-learning survey. So this is just a quick summary. Routine oral care is a simple and effective way to prevent NVAP. This project will and continue to have a positive impact on patient care and will make a significant contribution to patient safety and well-being. And just to stress the need for a standardized oral care protocol or guideline.